Do you think there'll ever be a time when an AI governance council in the healthcare system would actually include language access as part of that?
Sure.
Get
Yeah.
folded in at some point?
I do think that there are some, I would, if you were to poll different healthcare systems, I'm sure that there is a language access manager or leader that is involved in AI governance. Absolutely. Yeah. I it may not be that common quite yet because again, I think people are thinking of AI. I think that AI is a technology tool, and language access, I think, sometimes is thought of as a technology issue rather than a patient safety function or that requires human oversight. So, yeah, I think that as AI overlaps more with interpreting services, we will see language access leaders brought in more on the front end. I'm hoping that that's the case.
Do you have advice for people who feel siloed in their language access position? Do you have advice for them in order to kind of get a seat at that table?
Don't give up. Networking, I think, is huge, even within your own organization. Well, networking in two different ways. So let's talk about within the organization. So I think reaching out to your compliance director or your compliance leader or patient experience leader and bringing ideas to them. They aren't thinking of language access necessarily because there's they have a lot of other things. Compliance, for example, is just such a huge job. And language access is a small component of that. So although it's top of mind for me because that's what I do every day, it's not what they do every day. So bringing a question to them or suggesting, I would like to be able to partner with you to ensure that next time Joint Commission comes in that we are documenting interpreting services properly, or that AI tools are not being used improperly or something like that. Reaching out to them is super important. And then outside your organization, I strongly believe in networking again with other language access leaders, because there may be something being done at another healthcare system that isn't being done at yours, and you can take that idea and bring it back to your system. And that has helped in different areas. I've networked with people that are integrating with Epic, for example, and my healthcare system has been integrated with Epic for a long time, whereas yours might be brand new. So how am I using Epic when it comes to language access? If once I educate you on that, I may, my Epic IT team might talk to your Epic IT team and help, because they may not realize, there actually is a medical interpreter flow sheet that can be used, or these are the things that we've included on it, or that kind of thing. So, or how do I pull a report that shows how language access is being used and where the gaps are? So networking both internally and externally is super important.
Where can people find places to network externally with their peers?
Conferences are huge. I'm in full transparency, I'm the treasurer for the National Council on Interpreting in Healthcare. So we have a conference that actually we just did our first in-person conference since before COVID. So we're starting to do that on an annual basis. The next one is in September, and I believe it's going to be in New England. So that'll be a good one. Good time to go. Of course, CCHI, ATA, Paving the Way. There's so many different great conferences to LSPs, going to the LSP conference. There's so many great conferences that language access leaders can go to. And there's so much to learn from our peers. We all specialize in something different. So some learning from our peers is huge. I think also partnering with your language service provider. because language service providers like you work with so many different healthcare systems that if I'm venting to you about something that's not working in my healthcare system, you can go, oh, you know what? I have another customer of mine that actually just went through this same problem, and I think they would be a great person for you to talk to about how they resolved it. And it may not work for me, but maybe there'll be bits and pieces from what they did that will work for me. So I think not being complacent is the biggest thing. We can't be complacent. We owe it to our patients not to be complacent.